Investigations for aortic dissection include chest X-ray, echocardiography, CT angiography, MRI, and ECG. If the patient is unstable, go for transesophageal echocardiography. If the patient is stable or surgery is planned, go for CT angiography. CT angiography is 98 to 100% specific and sensitive to detect aortic dissection. But iodinated contrast is used in CT angiography, and if adequate volume of contrast is not used, its sensitivity and specificity is reduced. On the other hand, MRI has 98% sensitivity and specificity to detect the aortic dissection, but it is not available everywhere. It's a time-taking process, and it is contraindicated in those patients who have metallic implants. Typical chest X-ray finding in aortic dissection is widening of mediastinum or widening of the aortic contour. There is dilated ascending aorta, dilated descending aorta, and that is present in 70 to 80% of the cases. And in 20% of the cases, there is pleural effusion. But remember that chest X-ray can be normal in aortic dissection, and a normal chest X-ray does not exclude aortic dissection. So if there is a clinical suspicion, go for echocardiography, CT angiography, or MRI.